Hello, and welcome to Understanding the Menopause Phases. So, this might be a club that you really didn't want a membership in, and you're really not looking for a chipper happy person to talk to you about it. But I think with everything that we know about today's world, it all starts with knowledge. And the more you understand it, the more you can advocate for yourself, the more you know where to start, and the more that you can just hear you're normal. You are completely normal. So let's jump into that together and let's look at the menopause phases. So there are actually three menopause phases. And to be honest, there's two that get the most spotlight: perimenopause and menopause. And I was quite shocked when I started doing my studies and certifications to learn that there's still something even after menopause. Like, I thought menopause, done. I'm out playing tennis. Life's amazing. My menstrual cycle's left. But there is still a phase called postmenopause. And it has its own issues, which is just not fair. I really thought menopause was stop, end, and we're done. But it doesn't have to be the end all, and that's what this membership is gonna be all about, is how to help you get through each of these phases with optimal health. So, let's start with good old phase 1, perimenopause. So, it's that transitional phase before menopause gets here, and let me tell you, I thought menopause was kinda just gonna show up, and this is probably gonna show up so much in my membership, probably all over my podcast, but we have not done a good job of generationally handing down information from individual to individual about what menopause is. My mom and I have a really great relationship, and when I went to her and was like, "What is this perimenopause?" She was like, "I don't know, you just kinda get through it. That's what I was told." And I'm like, "No. No, no, no. This is not gonna work for me." And so you are seeing more famous people talking about it because we're all tired. We're tired of this, like, one day you just wake up and everything seems weird and nothing is working. And there's also things you can be doing before perimenopause shows up that can make your menopause journey a lot easier. So, little tangent on the side there, but I just had to tell you where we're going. So, you are marked by hormonal fluctuations that can begin as early as the 30s, most commonly somewhere, I think, usually in Black women, you'll see it early 40s, more often like in Latino and or in Latina and white culture, you're going to see maybe more like 45s, maybe even into the late 40s. And it's going to last for several years. So this is not like a get on and you're done type of ride. We're on this roller coaster for a while. So it does explain it here in the workbook for you. And I forgot to mention that. I'm so sorry. I just jumped in because I was ready to get on my tirade here. This workbook is for you. You can read through it, and you do not have to listen to me. For some of you, I know you may listen to me as you're driving or doing dishes, and listening is easier than using a workbook. Some of you are going to be complete dorks like me who love to watch and take notes in the workbook. So, lots of ways to do this. You do not have to listen to these videos. I do expand a little bit more on ideas in the videos, but again, you can still read through this workbook and get the gist. Okay, now back to the I'm gonna try to watch these tangents because that's how we get into these things. So back to the perimenopause. So it is during this time your ovaries are gradually producing less estrogen, and that's gonna lead to irregular menstrual cycles. And all of a sudden, you might suddenly have a heavier period than you did before, or now it's going lighter. Now you've got those lovely things like hot flashes, night sweats, mood swings, changes in your sexual interest. And then we're not even done because then you might have sleep disturbances, fatigue, and then your weight is going up or down, or you suddenly feel like you're at the gym and you're killing it except for that little hormone belly. And this is all part of that natural shift in the perimenopause. And so while it does signal the body's shift towards the end of the reproductive years, it's kind of giving you a heads up like if you were going to make that baby, now's kind of the time to let's seal the deal. It is a natural part of aging, and it does vary in duration and intensity for each individual. So please be kind to your friends who are like, no, I mean, my perimenopause was a breeze or my menopause wasn't that bad. There are folks out there who are magical unicorns who are just getting through this awesome. And then there's the rest of us little rhinos who are dying slowly day by day from these symptoms. And that's normal too. So, unfortunately, you just kind of see what you draw with your genetics and everything else in your environment. But managing symptoms does involve lifestyle adjustments. So, some of you have already thrown things at me, you've rolled your eyes, you said, "Here we go." But it truly is about stress reduction, nutrition, talking about some different treatments, interventions. I'm all in to talk about them all. I love herbal support. I love supplements. I understand some people prefer HRT, hormone replacement therapy. I'm not really here to knock it. What I'm here to do is just stay in my lane because I'm not medical in any route, but I am a person who's going through this, and I want an environment where we're all talking about it. So, just to put that out there, phase two, menopause arrives. And so this is the end of your menstruation process and your reproductive years. So now you can see it is usually in the late 40s into your 50s. This is where it gets so sneaky is it's diagnosed you have to go 12 months with consecutive months without a menstrual period. And let me tell you, some of my friends right now, they're like on month 8 and 9 and then their period's like, "Hi, I came back for one more round." And guess what? You have to start over. It's so disrespectful and rude, I know. So, but the thing you have to know is you really can't start to think, "I'm in menopause," till you go 12 consecutive months. And the reason for that is you're also experiencing a significant drop in your estrogen as you continue. The ovaries are kind of like, "Hey, there's no need to release eggs. We're done with family planning." You're going to still continue some wonderful symptoms: hot flashes, night sweats, mood swings, vaginal dryness. That sounds like a delight. Sleep disturbances. Also, you might still continue with some weight gain, hair thinning, and decreased bone density. That's great. I'm going to get heavier, lose my hair, and break bones. So while it is a normal part of aging, it does affect widely again among individuals. Some people are going to be like, "Oh, I've hot flashes." Others are going to be like, "Oh, my bones." So again, please don't give up on me. But a lot of this is going to come through lifestyle changes. And then let's talk about postmenopause. This one was a shocker to me. And I'm hoping that as menopause is being discussed more, postmenopause gets its moment to shine. Because really, I did think, like, once I make it to the end of menopause, end scene, life is awesome. Watch me be on a commercial playing tennis with my cute older adult friends, and life feels amazing because I'm out of this horrible time. No, 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 because the ovaries are producing significantly less estrogen, but now you're going to have some concerns because that estrogen had some role in our optimal health. So now you got to start thinking about things like osteoporosis, which is just fancy for like, I have bone problems, heart disease, and urinary incontinence. Sounds amazing. Also, you can still have some symptoms following you, like hot flashes, night sweats, and mood changes. They do become less frequent over time, but guess what? If things aren't operating optimally inside your body, some of these things are going to haunt you. So, some of you may not like me right now because you may be in menopause and thinking it's almost done. These hot sweats will go away. They may not. They may follow you into postmenopause. Vaginal dryness, changes in your sexual interest, wanting to do it, feeling it, anything, sleep disturbances. So now, not only do you need to kind of like figure out how to balance all those, but now you've got to add in bone health, heart health, balanced nutrition, physical activity. And then again, you might need to even speak to your healthcare providers or practitioners. But I think what's important to know is menopause, if you get past it and you still have symptoms, one, it's okay, you're normal. But two, we've got some things going on the inside that your healthcare provider or practitioner might need to know about so we can, start advocating for if I can't curb these by natural adjustments and lifestyle changes, what else is there for me? But I always encourage people, let's start with lifestyle changes first. I might be a little bit anti give me a pill for everything. Some of y'all may be like, forget it, I'll take a pill. But a lot of this can be adjusted by just a couple things that we do in our everyday life. So let's look at symptoms. Because if you might be like, I don't know, Tracy, where am I? So let's look at perimenopause. So, as we mentioned, the most noticeable symptom for perimenopause is going to be your menstrual patterns are starting to change. And this is where your periods again are going to be maybe suddenly, maybe you've never been irregular and now they are. Maybe they're coming early or now they're going longer than they used to. Your flow might even change. So you might have been a pretty consistent, like light, light, medium, medium, heavy, heavy end. And now you might be like light, stops, heavy, disappears, comes back, regular flow. That's all normal. You might skip some cycles. You might notice some spotting between periods. Again, this is all normal, but also these are the things you want to talk to your healthcare provider and practitioners about. Make sure the spotting between periods, is this related to perimenopause? Is there anything else that your doctor needs to take into account? Why I don't get into a lot of that is because I don't have access to your medical history. I don't know what you've been through. I don't know what medicines you're on. And so a lot of why I started this is I want to be a person to help you get ready for those visits so that you get the answers you need from the people who are supposed to be doing what we need them to do. You're going to have hormonal fluctuations and physical symptoms. So, again, we've got those lovely hot flashes, night sweats, breast tenderness. Um, and so that just tells you a little bit more. And then again, vaginal dryness, your change in sexual activity. It might be uncomfortable during sexual intercourse. And then mood and cognitive shifts, here we go. I feel like so many times I'm like, don't say that. Don't say it out loud. Don't say it. And then it just comes out. And then I'm like crying. And then I'm like, hold me. And so this is normal. It's normal. And while I know it's not fun, sometimes just to hear that you're normal can be enough to be like, I can get through today. So please know it is normal to have that brain fog. It is normal to have the hereafter. What am I hereafter? It is normal for you to stare at something for so long and be like, I used to be able to do this. I don't even remember my password. This is all normal. So let's talk about symptoms in menopause. Good old hot flashes and sweating. That's usually the first one everybody talks about is this is ruining my life. I saw a video the other day and it's so horrible. This poor woman was at a game and it was freezing and there was steam coming off her head because she was having a hot flash. I mean, it was absolutely horrible, but that's how a lot of us can feel. Your vaginal and sexual health changes. And then once again, here we are still with mood changes and physical symptoms. Again, please just hear me as this is normal. You are not abnormal. And these are important things to talk about in our healthcare system to make sure that you are being taken care of and doing everything right for overall health. Postmenopause, you might still have those hot flashes and night sweats. And then we already talked about those increased health risks. That's awesome, Tracy. You're just delivering good news day after day here. And then your emotional and cognitive changes. While your mood swings may lessen, it doesn't necessarily mean they could go away, especially depending on what's going on in your life at this time, how you went through menopause, all that stuff. So, it's not like you could wake up one morning and just be like, it's all gone. I made it. I'm postmenopause. This could linger, and it's not awesome news that I'm sharing with you right now, but it is normal, and it's okay to talk to your healthcare providers about it. So, what are some of these perimenopause hormones? What's changing inside of me? First one, estrogen. It is just beginning to it's going to go up and down, unpredictable. And so that's why you have these surges and then you have drops. And some of the symptoms it says is you're going to start noticing irregular periods, hot flashes, mood swings, breast tenderness. And this is what makes perimenopause unpredictable and challenging to manage, is because you don't know what your estrogen is going to do tomorrow. Progesterone is another one, and progesterone is so important. I kind of feel like it's the stepchild to estrogen. It doesn't ever get the love and attention it deserves. But this is, as it mentions in the second point there, it regulates your menstrual cycle, but it also protects against so many different types of cancers. It has such big roles in our body. And so progesterone needs a little more love and spotlight. And then good old testosterone. Who knows? It's you've either got too much, too little. It could be impacting your muscle tone, your energy levels. And so it does say there, though, it is usually less pronounced than that of estrogen or progesterone, but I mean, you only need a little testosterone to be off. Ask anyone who's done some treatment for testosterone, and they'll tell you, like, they wake up in a couple weeks and they're like, "What? I feel like a different person." So, menopause, what's happening to our hormones there? Significant drop in estrogen. So, nothing like in perimenopause. Now the body is like, okay, I think we're done. I don't think we're going to do this baby making thing anymore. And so, it's kind of like, well, we don't need to do that anymore. But as you see in the third bullet, estrogen's role is important in heart health. And it plays a role in a lot of other things like even vaginal dryness and bone density. So it still matters. We still need some of it. Number two, low progesterone levels again. And so, and a lot of that is because you're not so much interested, your body's not needing the menstrual cycle. And so again, it's, contributing changes in the uterus mood, and there are potential risks. And so that is why you want to keep an eye on your progesterone friend. And then here we are with decreased testosterone. So it's continuing to decline. And again, it's lower amounts than estrogen or progesterone, but it still is crucial. And look at those three: muscle mass, bone health, and sexual desire. Postmenopause, what's happening? Well, most likely and hopefully, you are stabilized, but you are low in estrogen. And that is where you definitely want to be talking to your doctors about what level is your estrogen at. Because again, third bullet point, it's affecting your bone health, heart health, vaginal tissue. Now you've got osteoporosis and heart disease and vaginal dryness to think about. So, keep an eye on it, see what's happening. Number two, minimal progesterone. So now you're kind of down to that postmenopausal phase. Ovulation is done. And so progesterone is not really necessarily being produced as much anymore because it's like, well, we're not doing the ovulation thing. And so, again, some people have selected hormone replacement therapy because they want some balance. Maybe some of those symptoms that are hanging on is because you need your estrogen and progesterone to level out a little bit. Again, talk to your healthcare provider, practitioners, and see what you can do to get yourself feeling better. And then consistent low testosterone now. So now, here we are. You're going to see things like decreased libido, muscle loss, and fatigue. And as it says, lower testosterone levels are a natural part of aging, but some people choose to address that. And it's sometimes it's just for energy, and sometimes it's for sexual health. I'm not here to judge. You do what you want to do with your life, but just to know that might be something you need to talk about with your healthcare provider. So, Tracy, why does it even matter that I track and understand menopause? Like, why? Why does this all matter? And so, as we say here, it is a significant life phase. It's one that is slowly getting brought out into the world. People are starting to talk about it, but it's the one that still is not being studied. A lot of the doctors I've seen were like, I don't know, I wasn't trained on anything big in menopause when I was in, doctor school. And I'm like, well, that's cool because I'm in front of you and I'm suffering. So figure it out. And so what I am learning about this process is the more that I track, the more facts that I produce, my doctor then has something to go off of, and I have something to push the agenda. It's not just, I'm having hot flashes. It's, I'd like you to look at my hot flash tracker, which is in this membership, by the way, and I'd like you to see when they're happening, how often they're happening, how long they're lasting, what it feels like, and I would like you to help me figure out what we're going to do today to fix that. It just makes it so much easier to kind of stick to your guns than kind of just being like, well, I'm having hot flashes and I'm miserable. Well, what does that mean? What does it look like? So you want to identify your triggers. You want to understand the severity and the pattern. Sometimes that severity and when it's happening can be so educational to our healthcare system. And that leads to the bullet number 3. With consistent records, healthcare providers can make more informed recommendations on lifestyle changes, supplements, or hormone therapy if you want to go that route. So, that's what I want to do. I want to help. I want to be your menopause lawyer. I want to put that case together. We're going to get the prosecution going, and then we're going to just lay out all the facts for your physician, and your physician is going to be like, "Wow, I wish all my patients were like you." Let's hope, at least that's my hope. So gaining insights into health risks. as we age, it's not awesome. We start, death starts making an appearance a little bit more likely every day. But if we get ahead of this, if we have the conversations, then maybe we can keep some of this from happening. So we don't want to live in a fear process. So we need to monitor our bones and our heart health. Things that you can do today, your 60, 70-year-old self will high five you later and be like, man, my bones are feeling awesome because you did the work. Your heart's going to be like, I can give you a couple more years because you put the work in. Need to understand your weight shifts. Listen, I've got the hormone belly. I am so sick of it. I am so sick of like doing what I can and it's still like I'm hanging in there because I like you. So you have to understand it and then you just have to lean into it, and it is going to include things that are not sexy, like what are you eating? How are you moving? How are you sleeping? All those things that we're like, "Oh, just give me a pill." But as you start to shift things, you will start to see some change. And then staying aware of mental health. Mental health is, huge right now, as it should be. But, there's kind of a joke at times like, "Oh, she's menopausal," or "Ooh, look at those mood swings." But this is serious stuff. This is not just you being dramatic. This is not just you being like, "Oh, this is my new condition." This isn't, if any of you love Saturday Night Live like I do, when they had Debbie Downer on, this is not you being a downer. These are realistic, real things that are happening to you. And so we want to address those so you can be a functioning, happy person, or at least a functioning, polite person. Maybe, maybe not. I'm not polite most of the time. So we don't want to be polite. Maybe we just don't want to, be anxious or cry at our desk every day. And lastly, empowering informed healthcare conversations. This is where I want to live. This is what I want to do for you. I am tired of going to a doctor and being sent to another doctor who sends me to another doctor, and I'm done. I'm going to have so many tools and so many things for you to use to put your case together and to take it to your appointment. And two tools that are in this month are the sleep tracker and the hot flash tracker. So make sure you check those out, use those. That is going to be able to help you because it is hard too. When we get to the doctors, you get 15 minutes. You can't remember, like, oh gosh. And especially if you're experiencing mood swings, brain fog, you're not feeling your best. You can't be like, okay, so the last 2 weeks, what was sleep like? But you could bring that piece of paper in and say, here you go, doc, look at this. Help me figure out some things. And it just really makes you feel confident. The more informed, the more knowledge you feel you have, then you know when you can push back. And let me just tell you straight out, you're going to hear this a lot on my podcast and a lot of other places. You can push back to your doctor. I respect the work that people have done. I respect that people go to work and they are there to truly do no harm and to help. But sometimes we tend to forget that the person living inside the body is a level of expert, because I live in this and you do not. And while my symptoms may be odd or that's different, that's great. Okay. But end of day, I know it's different because I live in here. And I don't live in any of your bodies, so I can't tell you what's normal for you. And so we have to advocate and we have to push back. And it's for some of us, we were raised to be kind people and don't ruffle things or say sorry. No. When you are not feeling well, when you are not optimal, when it is interrupting your life, you have the right to say, I appreciate what you're saying. However, based on what I have brought you, I feel there is a problem and I want a solution today. I'll stop there because this could go a lot longer. So, as I mentioned, there's some tools to help you track. You got the hot flash tracker, the sleep tracker, and then more tools are going to be coming each month that you can just continue to add to your little menopause arsenal. I hope this has been super helpful. Again, this isn't like the flashy, let's dive in. And I know for some of you, you're probably like, that's cool, Tracy. How do we get to these hot flash issues? How do we get those resolved? That is coming. But I also want you to have a basic understanding so that when you go in to advocate, if people try to confuse you or whatever, you know the facts. You know the phases now. You understand what your hormones are doing. You know what the symptoms look like, and that makes you a well-informed person. So, stick with me the next couple of months. We're going to start moving through some things that you can do, and also, don't forget that you have those chats. Some of you will have power hours that you can use to schedule some time with me. Let's talk about what is going on in your life, and let's start chipping away at it. And it might take several sessions. This is not an easy fix. It is try this, come back. What did that do? Okay, no change. Let's try this. Or, oh, big change. Celebrate. So, yeah, I just want to put that there. Lots of grace, lots of self compassion, and lots of patience. We can get ourselves to a very optimal level by making some very small adjustments. But again, this is not the reason this is such a big health issue is it's pretty disruptive in our lives. And so we have to be able to be okay with that and to slowly chip away at that until we feel better. So hang in there with me. I promise it can get better. And I look forward to seeing you in our next lesson.